Welcome back. On Viewpoint today, we touch upon the latest developments with regard to COVID-19. I have Professor Kim Moon-kyu from Yonsei University with me here in the studio. Professor Kim, it's good to see you again.
Thank you for having me.
Right, Professor Kim, as always then, perhaps we could start with a few words about Korea's current COVID-19 situation.
Yes, we went through a few outbreaks, and now we passed the biggest one, Omicron outbreak. And I think it started from January in here, Korea, and we reached the peak in mid-March, reaching about 8,000 cases per million. And now it declined to 190 per million and still declining. It's a good news. And there's a recent report from our health authorities that they screened the antibody positive rates in our population. The total number is only about 1,600, so the number is not so big. But strikingly, the antibody positive rate is 95%. If it's all came from vaccination, it's good, but actually the natural infection is about 36%. So that means even though we vaccinate our population, some of them got infected by natural infection. So I think they're going to start an extensive study for antibody positive rate in our population. We believe that immunity against COVID-19 will sustain for at least 6 months to 12 months. But all this data came from the research about antibody titer. But as we all know, we have T cells in our body, and nobody can measure how T cell works, how long they works. We have a very preliminary data of SARS in 2003, and those patients who had that infection still have some immunity against SARS 2003 in their T cells. So actually, we don't know how long we're going to have immunity against Omicron. Some might be longer. So let's say if there's no more new variant, I'm very optimistic. But recently, I got a report. I saw a report about Paxlovid, which is a medication fighting against COVID-19. There is a rebound of viruses after we stop this medication. So anyway, there might be a new variant. We still have to be vigilant for all these conditions.
Right, we still need to keep our eye on it then. And beyond Korea, Professor Kim, Moderna says its booster targeting Omicron shows a stronger immune response than its original vaccine. Could you tell us a bit more about this?
Well, all the vaccine products are made against the original Wuhan strain. And Moderna, they started to make a new one. It works not only for the original Wuhan strain, but also for the Omicron. So actually, that vaccine is composed of two components, each for Wuhan strain and the Omicron strain. So that's the reason why they call it bivalent. And this is not the first bivalent vaccine they developed. This company is trying to improve it every day. And now it's on the phase 2-3 clinical trial. The total number of the cases are just 430 some cases. So it's a very small number. I think they need to go on further with a full-scale phase 3 trial. And if they have the same result with this preliminary data, it's promising. It's going to work for the original strain and also for the Omicron.
Right, so it's something we can look forward to then.
Mm-hmm.
Professor Kim, according to data by the U.S. Centers for Disease Control and Prevention, since late February, boosted Americans appear to test positive for COVID-19 more often than those who were vaccinated but not boosted. Could you explain this finding for us?
It's a very complex question. I mean, we have to look at many things to explain why. So I would just give you some data they give out by the CDC in April. They checked the unvaccinated group. They checked the two-dose vaccinated group and compared with the boosted group. So there are three groups. The first one, unvaccinated group, was infected about 188 cases per 100,000. And the two-dose vaccination were far less, only 56 cases per 100 million. But strangely, the group who was boosted, so they got at least 3 shots, was 120, was about 2 times higher than the two-dose group. So still, vaccination is working, and it's preventing people from getting infections as we compare with unvaccinated group. But why the booster group having 2 times higher infection rate? So I'm going to give you 4 reasons, but as we have more reasons we have to tell, that means nothing is quite for sure. The first one, there might be some behavioral difference among those 2-shot groups and boosted group. So the people who got only 2 doses might have more careful about their behavior when they meet people, about hand washing or wearing masks. But the boosted group might mingle with people. They might have abandoned those prevention behaviors. So that's the second thing I can explain. I mean, Omicron is different from previous variants because they have a very, very high reproduction number. So that's the second explanation. The third one, the 2-dose group might already have infected with some kind of variants, Delta or Omicron. So they decided not to have the 3rd dose. So we have to look at the data.
So it's too early to make any judgments or draw any
and
conclusions.
The fourth one, how do we confirm that the patient is COVID-19 positive? If all the population is done by PCR, there's no argument. But suddenly we started to include the data collected by rapid antigen test. And there's a quite difference among those. So even though they say it's COVID negative, you don't know whether we repeat it with PCR, that patient might turn to be positive. So what is the meaning of the booster dose? I still believe that those booster group had benefits because we have a less hospitalization and less death. So compared to unvaccinated group. So people need booster shots, especially people with underlying conditions.
Right. And moving forward, Professor Kim, some health experts believe that COVID-19 patients with weak immune systems need to receive priority care because of the concern of new variants that you mentioned earlier. What are your thoughts on this?
Yeah, we have to remember that coronavirus is a RNA virus, and as long as the virus has a chance to replicate, it has a chance to mutate. And I said that I wish that no more new variants will emerge, but that's not true. It's going to emerge in the future, in the near future or far future, we don't know it, but it's going to emerge definitely. So healthy people have a strong immunity. They don't let the virus to replicate for a long time, only for a limited time, then we recover it. So virus is cleaned out. So virus have a less chance to mutate. But when the immune system is weak and compromised, they need a long time to fight against the virus, and sometimes they fail. So this virus have a long time to survive, and they mutated. RNA virus cannot mutate outside human cells. So you don't have to worry about that. So those immune-compromised patients need a special care. So if you have a patient suffering from COVID-19, we need to confirm that this patient is fully recovered and not giving out any new mutant, new variant. So health professionals should be very careful when they treat those patients under weak immune systems. And the patients also have to follow the instructions given by the doctors. Sometimes they say, it's enough. I don't want to have no more admission or, stop taking medications. But that's a very bad idea. So
it's a dangerous idea, then.
Yeah.
Professor Kim, staying also here on the local front, on Friday, health authorities will announce the fate of quarantine for COVID-19 patients here in the country. Should the quarantine be lifted or kept, Professor Kim? Your personal views on that?
Yes. COVID-19 is has many faces, but just I want to focus on Omicron. Omicron has, as I mentioned, has a very high reproduction number, and it's going to find out among the population who is not immune. And if the person is weak, I mean elderly, having underlying conditions, this person is going to get Omicron sometime in the future, even though they do their best. So I do believe that we need some degree of quarantine, and it will be dependent upon the population immunity, herd immunity, and so we need the results from a bigger size antibody test among Koreans, and that will decide the level of quarantine. And there are some special situations that need the minimum quarantine measures, like public transportations and nursing homes, and especially a family who has a person with high age or underlying conditions.
Right, I see. All right, I'm afraid that's all the time we have for today. Professor Kim, as always, thank you very much for your insights.
Thank you.